June is Men's Health Month, and medical experts use it to raise awareness on the importance of its annual health visit. Alicia Nespreto joining us now with why they say that men are more likely to skip the doctor's office.
Studies show men are about 25% less likely to visit a doctor than a woman, and more than half don't go for annual checkups. This can be a problem as they grow older and more at risk for different diseases. I had a chance to sit down with one man who chose to visit a doctor when something wasn't quite right and was very thankful that he did. David Mosio is a husband, a veteran, a marathon runner, and for the last few years, a patient at Texas Oncology in Waco.
Anytime they tell you that you have cancer, your first thought is you're going to die.
In 2015, when what looked like just a mole on his ankle started to bleed, Mosio said something did not feel right.
Immediately, I went and saw Dr. Rowe, and when they did the biopsy, they determined it was melanoma. We scheduled surgery immediately.
Despite that mole appearing a few years before, he was thankful to hear it had not spread at all.
I think we were blessed the fact that we caught ours early because it had not moved into a major organ.
Early detection can save lives, which is why Mosio recommends people listen to their bodies when something feels wrong.
We need to pay attention to our bodies and look at things that don't seem right and not be afraid. Go to the doctor and ask to look at things and not be stubborn.
It is extremely important that we pay attention on our health and try to prevent certain illnesses and diseases so that we can live healthy and long lives.
The leading cause for death in men is heart disease, followed by cancer. Cancer can look different in each person, and those with a family history are at a higher risk.
Any adult, man or woman, should go to a physician at least once a year and discuss with that specific physician which are the risks of certain cancers and certain conditions so the proper screening can be established.
Screenings are important and absolutely essential, especially if you're in remission for a disease like cancer. 2 years after Mosio's mole was removed, he found another.
It was very scary. It was very worrisome. And it took a while to get over the shock of it and understand that the fact that I was diagnosed with stage 4 cancer doesn't change my destiny with God 1 second.
While his cancer is now uncurable, Mosio has started a new type of immunotherapy at the Texas Oncology Clinic. It's meant to boost his immune system and stop the cancer from spreading any further.
I had as much trust and faith in my doctors because this is what they do every day. And so when they suggested that this is what we try, sure, I'm okay with that.
None of this would have been possible if he was part of the large percentage of men who don't see doctors. His advice for others: trust God, trust your doctors, and actually visit them when you need to. Doctors say the best way for people of either gender to remain healthy is to limit your alcohol, not smoke tobacco, don't spend too much time in the sun, eat healthy, and of course, annual doctor visits. Alicia Nespreto, 25 News.